Hi, my name is Stephanie Smith. I'm the Sports Metrics Coordinator at Cincinnati Sports Medicine. Today I just wanted to go over a few techniques with different types of agility movements. We know with a lot of ACL injuries, the injury occurs often when the athlete is decelerating. Mainly if they're coming up to an opponent and stopping quickly, or they're doing a quick change of direction. And there are a few techniques that we can try to tweak with our athletes just to try in any way to prevent this type of injury. So one thing that I like to tell my athletes, or if it's you training yourself, is anytime you make a sudden deceleration or you're cutting, you want to make sure that your feet are right underneath your body. Basically, this is going to help out with balance. A lot of times when the athlete sticks that foot out too far, they get off balance, their quad fires, and that puts a lot of strain on the ACL. So when the athlete is coming up to an opponent, you want to make sure the feet are right underneath the body. If you're cutting around a cone, you don't want to come up and stick your foot way out. So again, you want to make sure your feet are right underneath your center of gravity. Another thing that you want to keep in mind is to flex more at the knees. So you don't want to have those knees straight when you're cutting. So when you go around the cone, we encourage the athlete, at least in an environment where we're practicing a drill and there is a cone available, to reach all the way down and touch that cone. They're bending more at the knees, they're bending more at the hips, they're using their hamstrings, which are an ACL agonist, and they're going to help protect the ACL. So we have the athlete come around the cone, reach all the way down instead of being upright. Another thing that we want to keep in mind is a lot of times when the athlete goes into what we call a valgus position, this puts a lot of strain on the ACL as well. So when they're cutting around that cone, again, you want to make sure that they're not collapsing that knee in. So they want to have a nice square cut, both knees bent, knees not coming in. The final thing that we want to work on with the athlete, anytime they're cutting, pivoting, cutting around a cone, changing direction, they want to cut on the outside foot, which means if I'm coming up to this cone and cutting left, I want to plant and cut on my outside or my right foot around the cone. Reason being, if you cut on that inside foot and you plant, all of your body weight is on this leg, and then you're going to twist and put a lot of pressure and strain on the ACL. So again, we'll have the athlete come up, cut off the outside foot, and then around the cone. These are just a few techniques that you can keep in mind with your athletes. What we reviewed is to encourage the athlete to, again, get down a little bit lower, bend at the knees, bend at the hips, make sure their feet are right underneath their center of gravity, so don't stick that foot out far. Cut on the outside foot and make sure that knee doesn't cave inward anytime they cut.